Welcome to Dental Drills number 1. Hypersensitivity reactions, abbreviated by ACID. Anaphylactic reactions, A. Cytotoxic reactions, C. Immune complex deposition, I. And delayed reaction, D. Those dignify type 1, type 2, type 3, and type 4 reactions. Type 1 anaphylactic reaction or allergic reactions mediated by the immunoglobulin E complex. It's a quick onset and life-threatening, can be caused by several stimuli such as bees, latex in the gloves, or drugs like penicillin. Second hypersensitive reaction is called the cytotoxic reaction mediated by the antigen and antibody complex. When the host antibodies go in contact the antigen cells, causes host cell lysis in processes such as graft rejection. The third type of hypersensitivity reaction is called the immune complex deposition caused by the IgG and IgM complexes in the body. They can happen from diseases such as systemic lupus erythematosus or serum sickness disease, or vasculitis, alveolitis, and nephritis. The type 4 hypersensitivity reaction is known as delayed hypersensitivity, can be caused by chronic graft rejection, can be caused by poison ivy, nickel allergy, or even latex allergies, but it's a delayed response after 24 to 48 hours of exposure.